So with the U.S. one step closer to approving a coronavirus vaccine and Inauguration Day coming up, the Biden transition team is preparing to take over one of the worst health crises in history. Yesterday, the FDA panel recommended the use of the Pfizer vaccine, which will allow distribution to begin after approval in the upcoming days. Dr. Celine Gounder joins us now. She is a member of President-elect Biden's Coronavirus Advisory Board and an NYU epidemiologist. Thank you so much for joining us. So the FDA is authorizing the Pfizer vaccine for emergency use. The Biden team has some ambitious goals, though. We're talking about 100 million vaccinations in 100 days, implementing mask regulations where possible as well. So, does the team believe that this is realistic, at least at this point?
Well, we're going to be picking up the baton from the current administration. They do have plans in the works for how to start getting healthcare workers and nursing home residents and staff vaccinated. So that will be the first phase of vaccination, the highest priority groups. And we're still working on obtaining plans and really building on those plans. We'll be expanding those plans to include the next highest priority groups, which are really the critical infrastructure workers. So people who keep literally the trains running on time, and trying to identify who those people are to make sure that they get vaccinated next is also going to be a big challenge here.
You mentioned that you will be picking up the baton from the previous administration, from the Trump administration's task force. I'm wondering how the two groups, the advisory board and the task force, how are you guys working together? Because obviously you would want a seamless transition with similar goals. How's that going?
Yeah, so members of the Biden-Harris transition team have been meeting with members of the current administration. And, it takes a while, as you can imagine, to transfer this level of information, of detail, of plans from one team to the other. So that process is ongoing, but it is going, which is all very good.
Yesterday we spoke to the Lieutenant Governor of New York, Kathy Hochul, and, she sort of outlined this really ambitious plan to get the vaccine into the arms of people in need in the inner city, but also, obviously beyond that. And though New York State has New York City in it, there are also a lot of rural areas, a lot of small towns. And we also talked about, just how expensive something like this is. I want to play a little sound.
It is a disgrace that the federal government does not take on the responsibility of saying this is a national crisis. It is a global pandemic. It's not just a New York problem or a New Jersey problem or a Florida problem. All these states are going to have to incur extraordinary costs. On top of the loss in revenues we've all had to suffer, New York State alone is in the hole for $14 billion. That's just where we are right now. And so the federal government has a responsibility. Again, I served in Congress. I know the powers of the federal government. I know what they should be doing.
Now, I know you're probably sort of focused on the vaccine, but I wonder if in part of that conversation, there are also talks about just how the federal government can help the states pull this off, whether it's financially or otherwise.
Well, certainly state and local governments are going to need a lot of support. They're going to need support in terms of funding, other resources, staff. Unfortunately, public health departments have really suffered over the last 10 plus years or so. Since the 2008-2009 recession, we've lost about 50,000 public health workers across the country. And so you can't possibly rebuild all of that in a day, but that is going to be a process, and that's going to be a high priority, not just during the pandemic, but moving forward.
When you talk about rebuilding, I think another thing that needs to be rebuilt in this country is trust in the organizations that keep us safe. The FDA advisory panel approval is certainly encouraging. But we've all heard, the stories of severe allergic reactions in the UK. Not a lot, just 2 people. I'm wondering if, what U.S. citizens can expect in terms of side effects. There's been a lot of discussion about the need for health authorities to be honest about the process of getting this vaccine, that if people start to get sick a little bit or a couple of days after they get the vaccine, there's an opportunity for the spread of misinformation. So what can people expect?
Yeah, so, I think that the side effects with this will be a little bit more significant than what you might get with your regular flu shot. I would anticipate having some pain and soreness at the site of injection. You might have some headaches or fevers, fatigue for a day or so. But these are not severe side effects. These are, with a day off if necessary, something that you can certainly get over. And those side effects are far less serious than what getting the coronavirus itself would mean for you.
And to that point, I'm wondering if the advisory board has also talked about a clear public health message. Part of the challenge since March is that we've received so many different, a lot of different information. And I think, with all of that confusion, people are sort of picking and choosing what they want to believe. And that leads to misinformation as well. Having a clear public health message, I think, is really important. Is that also part of the plan?
Yeah, and so the clear public health message here is the president-elect is asking everyone in this country for the first 100 days he is in office to please wear a mask. Masks are effective at protecting the person wearing them as well as protecting others if you, unbeknownst to you, are harboring the virus yourself. It is a cheap, highly effective measure, and it does not shut down the economy. So if you want to be preventing transmission and continuing to some degree some of our economic activities, that is the number 1, 2, and 3 most important measure we have at our disposal right now. So that is clearly going to be front and center in what we're telling the American public in the coming weeks.
I think that is a great point, Dr. Gounder. If you are, upset that your governor is shutting down businesses, what you can do is wear a mask in order to slow the spread of the virus, and local businesses won't have to shut down. Dr. Gounder, thank you very much.